All right, we're here today with Professor Jesse Bump. He's a professor from Georgetown at the Department of International Health. And you're about to actually do a presentation with our discussion groups on global health and how it plays a role in grand strategy with a focus on Africa. So I just have a few questions that I'd actually like to ask you, being an expert. And I want to first say thank you for coming here tonight.
Oh, you're welcome. It's my pleasure.
Okay. So I'll start off first with the first question. Can you please briefly describe just overall your background, how you happened to come into the field of global health, and just a little bit about the field you're in?
Sure. Well, to start with, global health is an unusual practice area in that it's not defined by a discipline. It doesn't have a standard approach. It instead benefits from virtually any discipline. And what it trades for that lack of structure is it has a goal. So normal disciplines like, say, chemistry, they don't have a goal. Biology doesn't really have a goal. It has an approach, it has structure, it's a discipline, but in global health, we don't have any of those things. What we have instead is a goal, and the goal is, you could say, it's to advance humanity. So that means that almost any discipline contributes to it, and we come as practitioners from many places. I grew up on a farm in Vermont, and I got undergraduate degrees in astronomy and history, but I had this impulse to do something good for the world, and with those degrees and other ideas, I just began looking for ways to apply it. So I went to graduate school in the history of science, medicine, and technology at Johns Hopkins, and I just gravitated toward studying health, medicine, and technology transfer because of my interest in other places and in justice. Then I worked at the World Bank to try to apply the ideas. I later got an MPH, and I ended up at Georgetown because that is a good mix for me of opportunities, comparative advantages, and an opportunity to study things I really care about.
Great. I was also wondering, because we are with YPFP, foreign policy, what do you think, or how do you think global health fits into foreign policy?
So that's a great question. And on the inside, for practitioners of global health, they typically like to examine technical factors, medical factors, social scientific factors, biochemical factors. And in fact, virtually everything about global health is shaped by an external environment. Largely, that's foreign policy. And foreign policy is guided by military concerns, business concerns, security concerns. Global health is a small player in that agenda. It's certainly grown a lot in the last 10 years, but it remains usually number 4 or 5 or 6 on the list of concerns. So it's important for people in global health to be cognizant of the wider political factors and then think about what they mean and find ways to shape them in ways that are influential toward our own goals, which, as I said, might be advancing humanity.
Mm-hmm. Okay. And with that in mind, what would you say would be one of the biggest challenges in global health today?
Let's take that in 2 parts.
Okay.
The biggest challenge, you could say it might be behavior change. Behavior change is one of the holy grails of public health. So get people to wash their hands, wear some shoes, adopt sanitary practices. The list is fairly long, but you just get people to change their behaviors. Eat right, get exercise in a rich country context. Well, that is a huge challenge, and it's not really part of the usual approaches or solutions that are designed for public health. So that's a top challenge, is how can the discipline that's oriented around biochemical concepts and around scientific progress, how can it, while advancing those things, bring into practice this enormous back catalog of interventions that we have but aren't being implemented? You could put program management into that, leadership. These are all things that, if we could do them better, we would be able to implement the solutions that we have. And the solutions that we have are adequate for, you can make up a percentage, but 95, 99% of the lives lost in the developing world. That's one set of challenges. The other set of challenges would relate to the fact that global health is a small practice area largely shaped by national considerations independent of health, as I mentioned, so security, business, things like that. It's a challenge for people who are interested in promoting health to interface with those wider goals and negotiate resolutions and mutually agreeable solutions where their goals don't converge naturally. So think of tobacco control as one area where the goals are simply opposed. On one hand, it's selling a product that kills half of its regular users, and on the other hand, trying to ban the product. It takes some very creative solutions to find a way forward for both parties. In some cases, one party has to lose, or has to lose a lot. Typically, health isn't that oppositional, but there are opportunities for conflict in the food industry, in alcoholic beverage industries, in tobacco, in pharmaceuticals. Those are conflicts that we need to resolve, and largely they're conflicts that health people are not trained to address.
Okay. That actually brings me to my next question, which would be, for global health, what are your thoughts on focusing more on the public sector side with the ministries of health compared to actually working with private institutions?
It's a reasonable way to ask the question, but naturally I'll just dispute the way you ask it. And I'll say that in any particular context, you would need to assess both modalities, and you'd probably want to work with both of them. In some areas, it's simply not possible to work with the public sector because the public sector doesn't exist. So, for instance, in what's now southern Sudan, where there was no effective government for a long time, or in parts of Somalia or parts of Democratic Congo, where the government doesn't have a presence, typically you have to work with private partners, NGOs, even corporations, mining companies sometimes. On the other hand, there are goals that private sector businesses have that don't necessarily overlap with public service provision. So there's plenty of cases where the public sector is the right way to go. So where there is a public sector that can deliver the intervention, sure, they're great partners and they should be strengthened.
Okay. And basing your presentation today will be on global health and the strategy for it with a focus on Africa. Would you mind giving a brief explanation on that just for our members that are not actually here today for the presentation?
Sure. So what I'm going to talk about is how grand strategy has evolved since about 1600 to include global health. And it travels, that is, global health is, just to define it, this is my definition, not a formal one that you'll see written anywhere, but it's that part of developing country health that's of interest to people in rich countries. So it's not everything, it's just those things that are of interest to outsiders like ourselves. And what's in that bucket has changed a lot over time. But at the beginning, at the dawn, where I'm saying it's 1600, with the East India companies, the objectives of the companies was simply to extract as much wealth and as many resources as they could from other countries. And the idea of providing health for indigenes or indigenous populations was only a means to extract more.
Okay.
So where it's more efficient to, say, heal or promote health than to retrain or kill, that's how those decisions were made. And over the years, from that model into the colonial period, into the Cold War, and then the last period I'll talk about is the globalization era. In these four periods, the balance of power shifts. It shifts to make rich countries more equal to poor countries. So in the East India days, where it's simply military domination and almost no other consideration. In the colonial period, it starts with military domination, but by the end of the colonial period, the colonized people are able to extract some resources and some concessions from colonizing nations. And by and large, the colonial period ends because the colonizers feel it's no longer economically viable to colonize. So they say, okay, we're going to leave, you're going to be independent, we'll retain our extractive businesses largely, but you're on your own for health and other service provision. In the Cold War era, colonies get to choose, or formerly colonized places, they can choose between the US sphere and the Soviet sphere. And in some instances, as in Egypt or India, they were successful at getting things on both sides. Now, in the globalization period, developing countries have a lot more power. They have, in many cases, they've launched their own aid agencies, and they have many donors to choose from. So I'm going to talk about this process as it moves from one of indigenes completely dominated by external military forces with few channels to express their interest in health and few ways to leverage health services, to now where donors they're largely unable to drive the agenda themselves because there's too many donors, they compete with each other, and developing countries are in a much stronger position to extract things from donors. The story behind this is one of competition, how countries compete with each other and which ways they use global health in that competition. So then we're going to talk about what do countries actually want. So they do global health, but do they want health? Sometimes they want resources, sometimes they want votes in the United Nations, they want all kinds of things. Sometimes they may want health. So like in infectious disease control, they might want their own health, and for that they look at other people's health problems. We're going to talk about these forces and their implications for how global health can be made more effective for our insider purposes. That is, if we just want to advance health and we're less concerned about other issues like promoting certain businesses or certain rich country interests. And I don't mean a particular country like this one or another one, I just mean how do you make this enterprise more effective at producing health for poor countries? So in a market analysis, what you'd say is the government regulates the space of competition to produce better outcomes for customers. In our case, the customers are citizens of developing countries. So one implication is what regulatory framework can make the most of competition between countries through health aid. That's what we'll talk about.
Okay, great. I mean, it sounds very, very interesting, and I'm sure everybody else will actually learn a lot from that. What I'd also like to ask you then is, for young professionals that are here today and young professionals who are watching this right now, what is one lesson that you think they should take away from this?
Everybody has an interest. Each person, each company, each nation, and those interests can be diverse. They're almost always diverse. It doesn't matter why they overlap, but to be effective in this line of work or in many others, doing basic political analysis is one of the key underpinnings. So it's finding the right partners, building the right coalitions, and generating support for large movements. That's how you can change global health. It doesn't happen through, or doesn't normally happen through independent technical innovation. It doesn't happen because one person feels strong about it. It changes because large groups assemble behind a movement. That's one of our challenges in the global and in the public part of health. You're trying to move the middle of a distribution, so it's not about elites that adopt quickly, it's not about poor people who are left behind, it's about the big middle. And moving that means coalitions. Coalitions means political analysis.
Okay, great. And my last question would actually be for those of us who are looking to step into the realm of global health. How do you feel in terms of their educational background in attaining a master's and then in attaining a PhD?
So the question is, should they get more degrees? Like, should they get masters, should they get global health?
Does
PhD?
the level of education correlate with how in-depth they would like to go into the field?
This question is totally dependent on what they want to do. There's some lines of work where a PhD is required. If you want to teach at most universities, you need some kind of doctoral degree. It's a kind of union card. You can't get in without it. The value of actually having one as opposed to doing something else is, independently to be determined. But to get a job at a university, you just have to have one. If you want to go into vaccine development or a highly specialized technical field, it's very likely that you will need a PhD to get the training to understand how to advance the science. If your interests are, say, in management and managing programs, or improving leadership in our practice area, these are enormous problems with huge implications for our effectiveness. A PhD is not required. Those are skills that you can get at the master's level, and they're skills that you develop through practice. Maybe you don't need a master's degree at all. Military training, that's leadership training, it's management training. In the corporate ladder, that is management training. So there's lots of ways, and depending on an individual's goal, I would recommend either no schooling or additional schooling or maybe even doctoral studies. But it really depends on actually what they want to do. I wouldn't say as a blanket answer people need more degrees, because a degree isn't an outcome. It should be a way of developing skills, of getting towards something that you want to be more effective at doing.
Okay. Well, thank you
Does that
very
make any
much.
sense?
Yes, it does. So basically, different parts of the field have different background requirements that you would need for that.
Sure. If people did want doctoral studies, then it would depend on their particular interests, and then where they do it. That's another question. What they would study. It's all open-ended. I really wouldn't say there's a necessary path, and that comes from part of our strength is this diversity of approaches, of disciplines, of interests, even geographic areas, anywhere in the world.
Great. Well, that was the last question of this interview, and I'd like to say thank you for taking part in this, and
Sure.
thank you for being part of YPFP.
It's my pleasure.
Thank you very much.
Thanks.